Callahan responds to the argument based on self-determination in a variety of ways, but I want to focus on what I see as his main responses. So I think his first main response is simply to argue that the principle of self-determination does not actually apply to the practices of euthanasia and physician-assisted suicide. The reason for this is that these practices, according to Callahan, are not ones in which, or I should say, these are not practices which are actually personal and private. These are not practices where the person is partaking in an act that only involves themselves. Rather, PAS and euthanasia are inherently social and public practices because they involve medical physicians. They involve doctors. And doctors play a fundamental role in society, right? Moreover, the institution of medicine is overseen and regulated by the government and by laws. And so, therefore, if we allow euthanasia and physician assisted suicide, we are going to have to alter laws that actually impact all of society. So, just by definition, euthanasia and physician assisted suicide are not personal, private matters. They are social and public matters, and therefore, it involves others and it could harm others. Therefore, the principle of self-determination does not seem to apply. This is Callahan's first response. His second line of response is interesting and a bit more difficult, perhaps, to comprehend, but I think he may have a solid point, at least one worth considering. His response here is to point out or to highlight the fact that doctor-patient relationships are characterized by confidentiality. And what that means essentially is that the government and other members of society are not able or allowed to force themselves into the doctor-patient relationship. Okay, the doctor-patient relationship is confidential, it is private, and what happens between the doctor and his or her patient is solely between those two people. Okay, it does not have to be shared with anyone else if that patient does not wish for it to be that way. The problem that Callahan sees with this is that this confidentiality gives a lot of power to the doctor, okay? So let's try to make sense of this. What he's saying is that obviously these practices of PAS and active euthanasia involve the doctor ending the life or playing a role in the ending of life, the killing of this patient. If the relationship between the doctor and the patient is confidential, there will be no sure way to guarantee that the patient actually wants to die. In other words, Callahan has some serious concerns about a doctor influencing or perhaps even persuading a terminal patient into accepting PAS or active euthanasia. And of course, if this were to happen, if a doctor were to persuade or influence a patient to accept one of these two practices, then it becomes questionable whether that patient is engaging in these practices based on their own volition, based on self-determination. You might be thinking to yourself that this is outlandish, that this is unrealistic to think that medical physicians will somehow try to influence or persuade their patients into accepting these life-ending practices. However, as we know, Callahan cites some evidence that suggests that this does happen. And we will turn our attention to this in more detail later on in the presentation. But it's worth noting now that in the Netherlands, where active euthanasia is permitted, there have been studies that have shown that doctors do, in fact, persuade their patients into accepting PAS or active euthanasia when that patient did not initially request it. Or even worse, in the Netherlands, there are documented cases where the doctor actively euthanized their patient, even though the patient did not explicitly request for that euthanasia to take place. So Callahan has a concern that there will be no way to guarantee that a patient is engaging in PAS or active euthanasia of their own free will, of their own self-determination. And if that were to take place, meaning if euthanasia or PAS were to take place without the explicit consent or request of the patient, then of course that would not fulfill the argument or the principle based on self-determination. So this is Callahan's second line of response, and I'm particularly curious to see what you think about this supposed or potential danger in allowing doctors the power to kill their patients.